Azizlar, yana bitta podkastimizga xush kelibsizlar. Bugungi mehmonimiz doktor Ahmed Hilmi Kaya, neyroxirurg, professor, Anadolu shifoxonasida neyroxirurgiya bo'limining mudirlari. Doktor Ahmed Hilmi Kaya 30 yildan oshiq tajribaga ega doktor. Hocamiz hozir O'zbekistondalar. Shu O'zbekistondaliklardan foydalanib, birga savol-javob qilishga iltimos qildim. Bu iltimosimga xo'p degan javob berdilar. Rahmat ular uchun, shu fursat yaratib berganlari uchun. Hozir suhbatlashamiz va neyroxirurgiyaga tegishli ma'lum bir ma'lumotlarni ochiqcha gaplashib oydinlik kiritamiz. Hocam, assalomu alaykum, hoş geldiniz Özbekistan'a.
Aleykümselam Akbar, hoş bulduk.
İlk defa mı gidiyorsunuz?
İlk defa Özbekistan'dayım, hep merak ediyordum. Çok da mutluyum olduğum için.
Teşekkür ederim. Beğendiniz.
Çok beğendim. Bir defa kardeş ülke, yemekleri çok güzel, insanları çok iyi,
Teşekkür ederim.
hava yolları çok iyi.
Teşekkür ederim hocam, teşekkür ederim. Hocam, İngilizce konuşalım.
Tamamdır.
Thank you for joining us, Dr. Ahmed.
Thank you Akbar. Thank you Akbar. Yes.
Could you please briefly introduce yourself and your professional journey?
Okay. First of all, I'm from Turkey, you know. I was born in the Mediterranean coast. Then later I started my education in Istanbul in high school, Kabataş Erkek Lisesi. Then Istanbul University, Cerrahpaşa Medical Faculty in English. I went on to my education. Later in the same university, I fulfilled my neurosurgery residency. Then I worked in some universities in Turkey, private universities in Turkey, private hospital, especially in brain tumor, spinal tumor, spinal disorders, some stenosis, herniation, epilepsy surgery, and functional neurosurgery, such as Parkinson's disease, deep brain stimulation. Now we are still going on duty in one of the best hospital in Turkey, Anadolu Medical Center.
Thank you so much for your answer, for your detailed information. Hocam, why neurosurgery? Why you become neurosurgery?
You know, every medical faculty resident admire some part of the specialist region. When I first met to neurosurgery, I admired. I said, I must be a neurosurgeon. Then it goes on like that.
How long is the neurosurgery residency program in Turkey?
In Turkey, in my time, around 6 to 7 years. Now, 5-year residency is enough.
What part of neurosurgery is like you passionate about? Like brain or spine diseases, or you like every
because the patient is important. If there is a patient, if the patient can be treatable, yes, at that time it is admirable. If you perform your job, if the patient is happy, you will be very happy.
Mashallah.
Whatever the disease, yes.
Mashallah, this is absolutely true. Hocam, how long you are working as a neurosurgeon? What's your experience in terms of years?
Now, from the beginning of the residency as a neurosurgery practice, now I can say now just 30 years.
30 years.
But as a independent neurosurgeon, 23.
23.
Years.
Mashallah. Hocam, can you please tell me how many surgeries you have done so far?
Oh, I cannot remember. Thousands.
Thousands of surgeries. So
10,000 maybe, I don't know.
In average, in 1 week, how many surgeries you do right now?
Sometimes from my residency.
Right currently, like in 1 week, how many surgeries?
At least 4 to 5 big surgery.
4 to 5
at the moment, yes. Sometimes with the others, around to 10, we can say.
I see. Thank you so much. So if it's 1 week, 10 surgeries, 5 big and 10 small surgeries, it's around 15 surgeries. So in 1 month, you do
Maybe 10 to 15 change.
40 to 60 surgeries in 1 month.
Yes, we can say.
I see. Thank you so much, hocam. When people hear brain surgery, they often become scared. Yeah. How has neurosurgery changed during this 30 years of your experience in this field?
Lots of, from the invention of microneurosurgery and with additional affinities such as radiological developments and diagnostic developments, background of anatomical knowledge, modern era helps lots of in the development of brain tumor surgery. But every time the brain tumor diagnosis must not be big stress for the patient. Some brain tumors easily can be approached, exist, surgically treated. Of course, some deeply seated brain tumors still have some risk, but with modern equipments and neurosurgical approach, it can be performed successfully. But in some brain tumor, the only follow-up, you means every brain tumor does not need
This surgery.
the surgery. Yes.
Hocam, what is the most important, which symptoms? I will not separate the most important one, only one. Which symptoms patients need, if they had that symptoms, they need to get alerted and seek consultation with neurosurgeon?
Yes, we can say, firstly, headache. Headache is important findings, but it must not be understood that every headache means brain tumor. Only small percentage of the brain tumors with diagnosed by the headache. Headache can be from everything, even the anemia, even a stressful condition, even a migraine, etc., may cause headache. But especially if patient does not feel any headache in whole life, but chronically stressingly it started, at that time we must think, we must at least go to a doctor for the reason. And some findings of increased intracranial pressure. What is nausea, vomiting, double vision, etc. At that time, with headache, with these symptoms, at that time, yes, we must follow a specific order. At least one tomography and MRI must be performed. Sometimes the other severe findings, such as epileptic attacks. In case of epileptic attacks, first epileptic attacks in an adult patient, mostly we must consider a brain tumor. And sometimes, according to tumor location, there may be some neurological findings, such as if the tumor compressed the optic nerve, the vision may be lost. If the tumor is located in the language area, the speaking capacity may change. Some dysarthria, dysphagia, etc. At that time, yes, we must consider more the diagnosis of the brain tumor or other severe neurological disorders.
Hocam, what is the importance of quick decision in neurosurgery? If patient would got diagnosed with brain tumor or spinal disease, how fast they need to get the decision?
As needed. How can we decide this? Some disorders we are not obligatorily perform abrupt or quick operation. There is no need. But in some disorders, our quick decision and prompt operation is very important. For example, in intracranial hemorrhages, some intracranial tumors with big edema and shift, etc. At that time, the early decision and early operation is very, very important. So it changes according to clinical findings, the behavior of the tumor location, etc., etc.
Hocam, when you mentioned hemorrhage, another question rises in my mind. So, how many diseases apart of tumors we have in the brain and spine, like which need surgery or some surgical intervention? Apart from tumors.
Apart of lots of, for example, there are lots of reasons for intracranial hemorrhage. One of them is aneurysm, cerebral aneurysm. Cerebral aneurysm usually are insidious, and in some part of the life, it causes acute bleeding, coma, etc. At that time, in most of the patient with conscious headache, and you perform angiography and you saw that the aneurysm is the reason. At that time, emergent operation is highly important for saving the life, because second bleeding most probably with very, very high mortality. Sometimes, again, arteriovenous malformations, some cavernomas may cause bleeding, intracranial bleeding, intracerebral bleeding. At that time, if the patient condition, consciousness is also is not, at that time, mostly we must consider surgical intervention. And there are lots of other disease, traumatic events, otherwise some hematological problems, some reasons tends the patients to intracerebral bleedings are also important pathologies. Sometimes even the hypertensive intracerebral hemorrhage. In some hemorrhage, there is no need to operation, but in some, the early operation highly recommended.
Thank you very much for your answer. What is the most common brain tumor in you encounter?
Of course, when we think totally, if it is not the primary brain tumors, most of them are metastasis from the pulmonary metastasis, breast metastasis, prostate, colon, etc. But if we mention about the primary brain tumors, most of the brain tumors are in glial origin, primary brain tumors. For example, glioblastoma, one of the malignant tumor of the brain.
All brain tumors are malignant or no?
No, of course not. Some are malignant. Malignant means even we resect all the radiological tumor and even to additional adjuvant therapy, chemotherapy, radiotherapy, the tumor most probably will recur. This is the malignant. Sometimes the tumor is not malignant but tends to reoccurrence. Some tumors are not malignant. At that time, this means that even we resect, it may recur at the same site. The body produce. And some tumors are benign. If we resect it totally, most probably the patient will be cured. It will not reoccur again. Some tumors are highly, highly benign. Even according to age, according to patient condition, there may be possibility of stopping of the growth. At that time, we will only follow them. So there is not only one behavior in the brain tumors.
So many types are available, malignant, benign.
Yes.
Thank you. Hocam, what's the surgical techniques change during this 30 years of your experience? Maybe you tell about us neuronavigation, for example.
Neuromonitorization, neuronavigation, and also more radiological evaluation, and also more anatomical knowledge, better microscope, better microsurgical instruments. They change all the
Outcomes.
all the outcomes, of course.
Thank you so much. In brain tumors and spine tumors, in Anadolu, we have a multidisciplinary approach.
Yes, of
How
course.
important is that?
Why it is so important? Some for some specific diagnosis, there may be some different types of modalities. For example, in some tumors,
I'm sorry.
çok yaşa.
Teşekkür ederim hocam.
In some tumors, partial resection and additional radiation is more helpful. In some, total resection without any radiation, for example, may be more favorable. In some tumors nowadays, there are some adjunct new chemotherapeutic regimens. In next 3 or 5 years, we don't know what kind of new medications will come for the usage in the brain tumors. So if you use and if you discuss multidisciplinarily, you can achieve this treatment, the best treatment, better. It is very important in modern therapeutic evaluation.
In oncology, it's very important. This is so true. Ending the conversation about the brain and can we shift now to the spine?
Yeah.
Because it's very common. I think, like in my opinion, 7 patients out of 10, 7 people out of 10, they have back pain.
Yes, back pain is one of the most symptoms in the medicine after the upper respiratory tract infection. But there may be lots of reasons. What may be a reason from a neurosurgical point of view? Spinal tumor, disc herniations, spinal stenosis, etc., spinal infections. But most of the back pain are routine and there is no need to evaluation. If it becomes chronic, if it is increasing, at that time, at least doctor must see you.
What is the most when should patient get worried and need seek advice from neurosurgeon? What symptoms are so like?
During their life, there may be back pain and they may at least give some reason to it. For example, yesterday I walked so much, because of that there may be my pain. For example, yesterday we played football with our friends. During the playing, yes, this may be small, non-important muscular spasm. But if the patient radiates to leg, for example, at that time, important. This may be due to compression of the nerve, either disc herniation or tumoral pathology. For example, compression of the sciatic nerve may cause sciatalgia. At that time, we must go to the doctor. At least we can take some measures, some painkillers, if there is not any allergic reaction. We can wait for a couple of days. If it is again going on, at that time we must go to the doctor. If there is severe additional findings, such as urinary incontinence, some numbness in the feet, and some weakness in the feet, at that time, we must surely go to a doctor.
I see. Thank you so much. Hocam, just to summarize, so there were very important symptoms that's apart from the back pain, radiation to the leg,
Yes.
numbness, weakness in the limb,
Weakness.
in the leg, or
And also-
head, for example, yeah? Depending on the where
Level, of course.
Yeah. So, numbness, weakness, radiation of the pain. What else you have mentioned?
Urinary incontinence.
Urinary or fecal incontinence.
Fecal incontinence.
So this is very alerting symptoms.
Of course.
How do you decide whether a patient needs surgery or conservative treatment?
For example, we can speak about lumbar disc herniation. We know most of the lumbar disc herniation treated by body itself. First, there is a herniation. It compressed a little bit the nerve. It caused also inflammation. It caused also muscular spasm. But some couple of days, the inflammation decrease, the patient is better. Statistically, 90% of the disc herniations would heal themselves in 6 weeks. Even 70% of the disc herniation will heal in 15 days. Healing means decrease of the symptoms severely. The real healing in months. The body starts to eliminate the disc tissue, eats the disc tissue, immune system eats, cleans the disc area. Can you understand? And
Yeah.
there is a repairing process. But of course, we must see the patient. It is very important. If at the beginning, if there is severe weakness, at that time, we must operate. There is no need to have a risk for the patient. If there is any additional severe findings, later we will follow up. Some disc herniation, around the 5%, not tends to heal. At that time, yes, operation is an alternative technique. So there is no need to operate most of the disc herniations. Only we must follow. If there will be risk at that time, we may. Most of the herniations are healed by the body itself. Because of that, Akbar, it is very important. Every patient goes to somewhere, gives some advices. At that time, the others who are not doctors give lots of advices, because of that. 90% will heal, even without logical advice. This is very important. Don't forget.
So this is a big misconception that all hernias need to get treated by surgery.
Of course not. Of course
Big
only small percentage of them.
I see. What advice you will give to office workers who are during the day sitting mostly?
It always writes in the internet. It is not true. The true life is not compatible with such an advice. For example, I am a professor. I am performing disc herniation for many years. I do not always see this. This is not good. We must be comfortable. Of course. For example, watching the television at house in this condition, in the bed, it is not good for neck area. Abnormal sitting position are not good for back area. But we must feel as much as comfortable if we normally sit.
So,
And
what you
if
say?
we make routine exercise in some days in the weeks, it will be enough, in my opinion.
So what you're saying, comfortable sitting is very important.
Body feels,
Yeah, and periodically physical exercise is also
it will preserve
the
muscle tonus, and you will be healthy. At that time, there will not be any problem. If you not perform vigorous exercise, harmful behaviors, at that time, there is no need to take some specific measures, in my opinion.
Hocam, I want to talk about DBS, deep brain stimulation. When it is really indicated, like
For example.
patient need to get treated first in tablets, where the tablets is not working, then we do DBS. Can you please
For example,
explain?
let's consider the Parkinson disease.
Okay.
In the Parkinson disease, early time, if idiopathic Parkinson disease, mostly these are highly effective for deep brain stimulation, but in idiopathic Parkinson, at the beginning, if the diagnosis performed by the neurologist, first choice is the medication. With the medication, the patient will be very happy. There is no need to another measure. We say honeymoon period for 3 to 5 to 7 years, the patient will be very happy with the medication.
Uh-huh.
Of course, in that early time, we can perform deep brain stimulation in some selected case. But what is the meaning of the deep brain stimulation? Deep brain stimulation brings patient to again the first stage of the Parkinson, that the patient was happy with medication. During the time, the medication is not effective at the beginning, and additionally, adverse effect of the medication, dyskinesias, hypermobilities. At that time, deep brain stimulation brings the patient to the back that the medication was effective without side effect again. So, at the beginning, good neurologists follow up with the medication. Then, if the medication is not so effective and adverse effect, it is the time of the deep brain stimulation. Don't worry.
So when honeymoon ends, we do DBS.
After that time, yes.
Yes. Okay. Thank you so much. Is DBS complex surgery?
No. Complex for us, not for the patient. For example, we perform brain tumors, AVMs. At that time, we make some incision, some bony aperture. In the DBS, we only perform holes. From that holes, we put the catheters. But millimetric nuclei in the brain. At that time, trajectory, calculating, everything is highly important for the success rate, for the exact localization. So, it is not a complex surgery, but for us, it is important for tiring and calculation obsessively, performing some specific measures.
How long does it last, that DBS?
Nowadays, even we do not perform any micro recording during the operation. With modern radiological developments, we can exactly localize the nuclei with our radiological. Nowadays, around 2 to 3 hours is enough.
Is the patient awake during the DBS?
We can perform with also awake sound stimulation, but in modern time, there is no need to perform awake operation, because we perform the awake operation because we need to see the effect of the stimulation for the arm, etc. But nowadays, with modern radiological equipment, there is no need. Directly target the nuclei. There is no need to awake cryotomy.
I see.
Burn hole.
I heard about the battery and stuff like that in DBS. After DBS has done, how long does it take? Do they need to change some battery or something like that?
It depends on the patient's needs, and it depends on the battery type. Some battery types are rechargeable, for example, 12 years. Some, there is no need to recharging 5 years, 7 years, etc. But the second operation does not mean the repeating operation again. Only we change the battery. It is very simple, even with the local anesthesia.
I see. Thank you very much for that information. Hocam, if you want to say or give one message about neurosurgery to enlighten the frightness about neurosurgery to the people. So if they're afraid, if you want to give one message, what will be that message?
For example, I can give example. Sometimes we saw some patients, for example, spinal tumor, intramedullary tumor, the brain tumor. We are very sorry at that time as a neurosurgeon. For example, at the beginning, the tumor is located in safe, and if we resect that tumor, these are some benign tumors, maybe more than 15 years there, it will not reoccur again. But some patients or patients' relatives afraid and prefer the radiotherapy. Yes, of course, radiotherapy is also effective in some tumors. But at that tumor, radiotherapy is not so good. The operation is good. Can you understand?
Yes.
Sometimes the patients waits with radiotherapy, etc. The tumor is bigger, more risky. Can you understand? More complicated. Sometimes due to the radiotherapy, tumor periphery is very adhesive. The surgical risk increase. So please, at that time, you must follow the instructions of the neurosurgeon. For example, you went a neurosurgeon. Please take a second opinion from another neurosurgeon. From another neurosurgeon. At least 3 of or more of them say the same things. At that time, there is no need to afraid. Can you understand me? This is important. If the patient will have correct diagnosis, correct surgery in correct center from the correct surgeon, there is no need to think. Yes, of course, there may be complication. Even the plane can crash when you're traveling. So, the important thing is safe decision and a safe procedure. Everybody can be patient. There may be illness in all of us. If there is an illness, we must follow the best or correct areas for treatment. This is my advice from the point of neurosurgical view.
Thank you so much for coming.
You're welcome.
Thank you so much for information you had given to us. Good luck in your career.
Thank you. I specifically thank you, and I am very happy again in being Uzbekistan.
Thank you.
Thank you.
Hocam teşekkür ederim.
Ben teşekkür ederim.